Opioid use disorder is a chronic medical disease. It's treatable, and just like hypertension, diabetes, you're on medications, it manages your symptoms, makes you feel good. We have patients, one patient took a peer recovery class and she's done very well with it. We have patients that have jobs for the first time ever. We have patients that are living back with their families. We have patients that have gotten their children back when they were taken away. So yes, we see success with it. If you were a tribal citizen, I'd tell you to come see me. The first thing is this: you have to come in. You know, that's the biggest step. You have to come in, be willing to get help. A lot of patients aren't there yet, which is okay. But when you're ready, you just have to show up. We'll explain everything. We'll walk you through it. We will help you, but you have to come in. You can be successful. It's not going to be easy. It's not a quick fix, but you can be successful. Patients are like, oh, you're just using a crutch. No, it's not. It's like any other chronic disease. You have to be on medications chronically to treat them. I have patients that come in, you know, I'm just a druggie, you know, I'm just looking for my next fix or what have you. It's getting them to understand themselves what this medication and what this program's about. And if you can do that, then usually they come around. In the beginning, we see them maybe 2-3 times a week. Then maybe once we get their dose fine-tuned, once a week for a couple weeks, maybe every other week. We try to get them to every 28 days or once a month. We do have some patients that have been in the program for a couple of years now. We have a couple patients that we do have on a 3-month regimen now. Nothing's perfect, and this isn't easy. You just have to show up. To see like the life back in them again. It's just they have a different look about them. They talk about themselves and their situations differently. It's just everything is completely different. You do have to be established with the clinic. You can come in and we have medications that help curb those cravings. It's called Suboxone. And then we have an injectable version that's called Sublocade. You can't just start the medications. You have to be in a mild to moderate withdrawal. We slowly introduce the medications to your system, and then it slowly builds up in your system. Your withdrawal symptoms go down. Patient starts feeling normal again. And then we fine-tune it to get the exact dose that they need. That's kind of part of the process. Like I said, addiction's complex. It's not an easy fix, otherwise we wouldn't have any problems. Everybody'd be fixed magically. Patients usually are able to get like a job again, go back to school, reconnect with their families. It's a way of getting back into society, I guess you could say. We come up with a game plan. What is it that you're wanting out of this? What they're fighting for, I guess, is what I like to see. You know, they're fighting for their child, or they're fighting for their spouse, or they have to have a reason. They have to know what it is they want to fight for.